My son David was diagnosed after 4 long years of struggle and illness and doctor visits and hospital stays with Crohn's. We had never heard the word, we didn't know what it meant, and after investigation, at least we had a name to what was troubling him. The second son presented with this disease 10 years later, and it was completely different. I'm a parent who was very frustrated, not knowing, seeing the child suffer, not knowing why, having no answers, seeing him shrink from a robust child to an emaciated human being. It was very, very difficult. So it was important for us to know what he had and to decide what we were going to do about this. For myself and my husband, it was very important that we understood what his options were. Coming from a medical family, I knew that there were reactions to drugs. I didn't know what he was going to be given. Even though we had a name, very few people knew what Crohn's disease was. So it was dealing with the unknown. It was scary.
I initially started having symptoms when I was 14 years old. Symptoms ranged from cramping, blood in the stool, but by the time I was 24, there were times where I was spending, multiple hours of a day in the bathroom. When I got referred to a GI, it was determined that I actually had ulcerative colitis.
Patients need to be very aware and knowledgeable about their disease so that they can really team up with their physician and understand better their evolution. It is a good thing when the patient can come in prepared, being able to summarize a little bit of how they feel, and then get into the details about how severe the abdominal pains have been, how the diarrheas or the rectal bleeding. So give us a nice, good picture.
Understanding yourself allows you to be a better partner with your doctors and your nurse, and on top of that, it allows you to make yourself as healthy as possible.
When I first met with the gastroenterologist after David was diagnosed, I would say we didn't have the right questions, but as a parent, we asked what we felt was important. We were very concerned and tried to learn as much as we could at the time.
When I was first diagnosed, I had no idea what Crohn's or colitis was. I was told to take this medication, and pretty much I should be healthy. What I should have done is ask more questions concerning diet. I should have asked more questions about where I can get more information. Are there symposiums? Are there events that I should be attending? Is there any particular research I should be doing in terms of the kinds of medications that are available? And who would be the best resource to get that information from?
There are general complications depending on the type of inflammatory bowel disease you have. Increase of your abdominal pains, increase of severity, different abdominal pains that will not stop. They are not the usual cramps that you get, but they just do not subside. Fevers, rectal bleeding, massive rectal bleeding should be addressed, obviously. And then there are others that come around that are extra intestinal manifestations that you should also be aware. Like the most frequent of the extra intestinal manifestation is arthritis or joint pains. That's the most frequent. That should be, if you do have these and you're not asked about, you should talk about them, because this is very frequent complication of Crohn's disease.
At what point are, if I have any kinds of ulcers elsewhere, like in my eyes or in my inner mouth, is that just me catching a cold or catching some kind of infection? At what point should I be concerned, and should I be contacting you directly, or should I maybe even be contacting your GI nurse so that they can make a more informed decision whether I really do need to come in and see you earlier?
Other manifestation could be skin diseases that are kind of painful, and so you should talk about any skin manifestations that are very unusual for you. All the medications we are going to be prescribing in inflammatory bowel disease will act with a different delay. And every time that I start a patient on a medication, I will tell him that there might be a delay before we see a potential action of that medication. To give you an example, if you start somebody on perinethol or Imuran, the median time before it starts acting will be 3 months. They must know that during that period, they need to receive a medication which will bridge until the beginning of the action of Imuran or perinethol. When you start biologics, you might have a response very early on, but it might take, for some medications, 3 infusions, or some other time with injections, subcutaneous, it can take up to 2 months. Every time I prescribe a medication, I will go through the side effects. So I say, if you ever have a pain, which is very unusual, you call the GI team on call and you come to the emergency room.
Once you understand what the side effects are, you can be on alert. You can be ready for those side effects. So should any of those happen, or you suspect that they're happening, you can have that quick conversation with your GI nurse, or maybe even reach out to your GI.
It is important that their sources of information be scientifically based. And I do believe that if their sources are not good sources, they might be very confusing for our patients. They'd be in terms of medication and diets, etc. So this is a good conversation that the patient may have with his or her physician.
Outside of the information I was getting from my GI or my GI nurse, I was doing a lot of research on the internet. Always, you have to be careful. There are caveats with the information that's available from there. I think where I probably got the most out of is when I joined the CCFC. And for me, that was crucial because most of the executive members of the local chapter here in Montreal either are patients that have it, or they know someone, a child or a brother or someone. So we are all part of a group who've been affected by IBD in one form or another.
Sometimes it's a good idea to write down details of things that they want to discuss with us so that the visit is more positive.
And the better the answers you give your doctor, the better they will be able to understand where you're currently at with your illness. And that'll affect treatment significantly. So a journal or log of some sorts, I think, would be probably number one.
Most of the time at the beginning, we might have a hard time predicting remissions and relapses. Some disorders, as let's say an ileal stenosis, where the small bowel is narrowed, we can make the patient aware that they could evolve toward getting so narrowed that they would need surgery.
It's particularly important to know the signs, to be able to tell the difference between feeling well and being really truly sick, because that'll affect the kind of treatment and the kind of medication that you'll be given. You may want to have to tweak or adjust, move from either a suppository to an enema to an oral pill based on how you're feeling, without having to rush to the doctor or rush to the hospital every time.
It is extremely tempting as a human being to say that when you're in remission, you would like to stop your medication. And we know that in inflammatory bowel disease, unfortunately, if you stop your medication, you will relapse. So it is normal to ask about, is it still necessary when I'm in remission? But yes, it is. And we know that compliance in teenagers and adults is not always perfect, and we're very aware of that, and so we can have a discussion about compliance.
Even if a current medication is working for you, is there something out there that might be better? To, not just be stable, but maybe, take you that next step, make you feel a little bit better.
Biologic therapy should be discussed with our patient, particularly patients that do not respond or have lost their response to the previous medications they were on.
There are a number of products out there that are either given via infusion or you self-inject. And the beauty of this is you're not taking daily medication. You're not just also dealing with the symptoms. Hopefully, you may be actually dealing with some of the more root causes, and that might actually take you to the next step in terms of feeling better.
Pregnancies, planned pregnancies should be discussed with the gastroenterologist. There are some medications that will have to be stopped if you are planning on getting pregnant. There are patients who might, because of previous surgeries, have more difficult time becoming pregnant, and this also should be addressed. In a family, if there is a case that it be a mother, the father, or siblings with an inflammatory bowel disease, the probability of having inflammatory bowel disease in that family, so first relatives, is 10 to 15%. If both parents have inflammatory bowel disease, your probability or your risk increased to over 33%.
It's very important to know kids suffer in other ways terribly from this disease.
A major aspect that is different compared to adult is growth stunting. And this is one of the questions that will be addressed with the parents, because this is one of our other points to consider in the management of pediatric inflammatory bowel disease. There are some medications that might affect the growth, as prednisone. The big issue with our medications is having the patient in remission and having a great quality of life. And so we will weigh the benefits as compared to the side effects of all the medications we are going to prescribe, and make sure that they have the better quality of life, that they're in remission, and that they grow as much as they can grow. What is very important for us is to enable the teenager to become in control of their disease. Right from the period from 12 to 18 years old, we are working on giving more responsibilities to teenagers so that they know about their disease, what they take as a treatment, the side effects, and gradually get them to be the one taking care of the disease.
I think it's the most important thing that IBD patients know about their disease and that they become advocates for themselves.
I was asking questions about diet, specific questions about diet. I was asking specific questions about drugs and interactions. I was asking, very, very specific questions about, if this doesn't work, what's the next step? I was being more informed, and because I was being more informed, when I was sitting in front of the doctor, when I did have his 5 minutes or his 8 minutes or 10 minutes of his time, I think we were having a more meaningful conversation. And I think the fact that I'm more informed, it's providing me with a higher level of certainty that there will be a cure. Not today, not tomorrow, maybe not even in 5 years, but eventually we can hope for a cure.
Wherever a person is in their IBD journey, if they learn more about the disease, they will be better equipped to cope with it and to make the right decisions for themselves and go on and enjoy a good and full life.